Hello, everyone, and welcome. My name is Meena Dayak, and I am the Executive Vice President, Market Intelligence at Open Minds. I will be the moderator for your web briefing today. As you continue to navigate the extreme turbulence and disruption that COVID-19 has created, we at Open Minds are here to help you with our new program that we launched late in March, the Executive Blueprint for Crisis Management. Through this program, we've been bringing you a series of web briefings and technical assistance resources. And today we are into, not sure of the exact number, it might be our 10th or 11th web briefing. And I'm very pleased to have my colleague, Richard Lewis, Vice President at Open Minds, who is here to walk you through increasing your service volume by creating a crisis referral development plan. Just a little bit about Richard. He has extensive experience as a behavioral health administrator, business development specialist, and innovator of new service lines for national for-profit behavioral health organizations. Before he came to Open Minds, Richard was the Director of Development, Behavior and Addiction Medicine at the Southern California Healthcare Systems Incorporated, Prospect Medical. And he was involved in many consulting projects there focused on healthcare integration, developing new service lines, and health plan contract development. Richard was also the Executive Director of Strategic Development and Planning at Pathways Molina Healthcare, another national for-profit behavioral health company operating in 23 states. And Richard is a former psychiatric hospital administrator and assistant director of mental health at San Bernardino County of Department of Behavioral Health in California. He is experienced in behavioral health project management, clinical operations, strategic alliances, and outcome-based service delivery models for complex adult and youth populations. So that is an impressive resume, and I know that I haven't even touched the surface yet. He has many more credentials, but I will hand it off to Richard in just a minute after a couple of housekeeping reminders. Your audio is muted today. You're not able to speak during today's web briefing, but we really want to hear from you. We want you to take advantage of this time with the Open Minds team of experts, with Richard in particular, and to send us your questions and your comments. Throughout the webinar, you just need to click on the little question box you see on the right of your screen, type your question in and send it to us at any time during the briefing today. And once he is done with his presentation, Richard will stay on the line as long as is needed to walk through all the answers to all of your questions. You will also get the fabulous slide deck and the recording from today's briefing. It will be available on the Open Minds website, and we will send you an email with the link by tomorrow morning as well. So thank you all for joining us today. And with that, I'm going to hand it off to Richard.
Thank you, Meena. Thank you for the introduction. I appreciate it. Good morning, everybody, or at least good morning for those of you who are here on the West Coast. I'm hailing from beautiful, sunny Southern California here in Los Angeles, and I'm very happy to be here to present today's webinar on increasing your service volume, how to create a crisis referral development plan. Meena already explained that this is part of the Open Minds executive blueprint for crisis management and building organizational sustainability and success in a disrupted market. And certainly that's what we're going to be focusing on today in terms of how we get our referral flow started again, given the many issues that provider organizations have been dealing with or that have been thrust upon you just in the past few months because of the changes in our market and service delivery systems because of the pandemic. We'll cover today an overview of creating a crisis referral development plan and really some key aspects, some key components of that and what it takes to do that. And we're going to focus today on referral source education. How do we reintroduce our programs and services to our old or traditional referral sources? How do we get our message out about changes that may have, changes that you may have adopted in your organizations with regard to making referrals, assessment of clients, given the new rules of the world, with social distancing and things related to health and safety for your clients and families. We'll talk about, should have put that on mute. We'll talk a little bit about some marketing and outreach. And I'm throwing in here kind of on a side note, I think we traditionally consider referral sources as community-based stakeholders, school districts, whatnot, that make referrals to our programs and services. But I also want to talk a little bit about payers and some of the things that we'll need to be doing with payers as they make referrals to their provider networks and to your programs and services. Definitely there's been a decrease in referrals because of the COVID-19 pandemic. For the past 3 or 4 months, I mean, everything has pretty much almost come to a standstill for health and human service providers in the community as a result of the pandemic. Shelter-in-place orders have forced not only your organizations, but other community organizations and your referral sources to maybe have to close their doors. I listed just a few, and I'm sure in your market there's a dozen more. School districts are closed, and I'll use them as a good example. School districts are closed and have traditionally been a huge referral source for many behavioral healthcare providers, autism providers out there. You may have co-located programs on schools, but that's just been just one example of a huge system closure that's impacted and caused a decrease in referrals. College and universities are closed, outpatient primary clinics are closed. I mean, all of these things have really impacted the flow of referrals to your programs and services as a result of shelter in place. Social distancing practices as well have limited, if not eliminated, a lot of community stakeholder provider organizations or government agencies that traditionally have made referral sources to you. That lack of one-to-one engagement that really has been the key for making referrals and conducting assessments to get those referrals to your programs and services have all been stopped. I think they'll probably slowly start to come back. And certainly, today's webinar is to talk about how we can start to rebuild the flow of referrals to your programs and services. So, consumer referrals are the lifeblood and source of revenue for provider organizations. Doing some type of crisis referral development planning is essential in being proactive in re-stimulating your organization's referral flow that has been disrupted from the pandemic. This process will definitely serve or be the beginning of updating your marketing business development plan, and may and probably definitely lead to new strategies for repositioning your organization in today's market. Everything that you had in your strategic development plan, your strategic plan for your 1, 2, 3 year plan pre-pandemic has likely been changed, if not partially, but maybe almost completely. And this is certainly one aspect of your strategic planning process. So we're going to talk a little bit now about referral source education, how we get our message out to providers about changes that may have occurred in your programs and services that have affected your ability to process in a timely manner new referrals and get client assessments back in place, and talk a little bit about some of the marketing and outreach activities that are some immediate items that we should be looking at. First, you want to reassess your referral development plan. It's normally part of your marketing and business development plan. It's the piece of your marketing plan that traditionally would target the activities and things you're going to be doing with specific referral sources to achieve your referral goals in terms of number of referrals, types of referrals, referrals that have certain types of funding for your programs and services. And you're going to want to identify new payer and referral source challenges in getting referrals, referral source flowing, and developing customer-friendly solutions to remove obstacles. A lot of what we're going to be talking about today has to do with not only your organization's referral process and your referral outreach and engagement, but it also, we're going to talk a little bit about thinking more about the changes that have affected your referral sources that have may created some obstacles and barriers to making referrals to your organization. Because just as we as providers have been impacted by the pandemic, your referral sources have as well in very much the same ways that you have. So really, the referral source education piece of our crisis development planning is really a process of reintroducing yourself as an organization to your existing referral network and folks that would traditionally make referrals to you, as well as any new referral sources that you identify that are part of your referral network. And you know, it's a message of I'm still here. We're open for business. Here's how to make a referral. Here are some of the changes that have occurred in terms of our programs and services that we need you to know. And you know, here's how to make a referral. This proactive outreach and education will give you a competitive head start, because remember, it's not only your organization that's trying to get referrals going again, it's all of your competition. And we're really kind of looking at a bit of a reset here. Business has been stopped. It's kind of like we're all here at the starting line, and now the gun goes off, and now it's who can get out there first and you know, make yourself known in the market. Informing your referral sources about any changes. Again, your programs and services may have sustained operational changes. You may have different business hours. There may have been programs and services that are you're no longer providing. You may have capacity issues now, as employees may have been moved to working off-site. We have less folks at the provider site to do some of the roles that we were doing before, in terms of taking assessment referral calls or doing assessments of new clients. The opportunities for face-to-face client contact is limited, if not curtailed. We've got to start thinking about that. We talked about business hours may have changed in your organization. We know that office space is going to be limited because of social distancing. We're seeing parking restrictions in some market where every other space can be occupied so that there's distancing in parking lots. All of these things impact your ability to have an easy way for clients to come to your programs and services. We may have delays now in terms of staggering office visits or client assessments because of social distancing and these things. Other obstacles that we need to be thinking about are things like how the transportation system may be affected in your area. Many clients and families refer on public transportation for getting to your organization. Bus lines, buses may only be filled to half capacity now. Is this going to cause delays in how people get to your services? And certainly wanting to get the word out about any new health and safety precautions or steps that you've taken so that people feel safe to come to your site for the treatment that they were getting before. You'll want to definitely include in your referral source education. So here are just some of them. It's kind of weird to think that now even referral sources are going to have a bit of a challenge in making referral sources to you because of the pandemic. largely because they now have the burden of reassuring, if you will, a client or family that they're referring to your organization, that your organization is a safe place to go. It's a safe place to be. And so your messaging in your education referral sources, you really want to focus on letting them know that your site is safe, that you've taken the right precautions that are recommended, from the government guidelines for health and safety. And you want to let them know there may be changes in when you're making referrals to your organization in the process. You may be taking temperatures of clients at the front door now. There may be some type of new health screening that you may have implemented in your organization for folks that are coming to your site now. Let people know that masks are going to be required for folks that are coming in for assessment or treatment. All of these are things that are new now, and things that we'll have to start to talk more about in helping referral sources feel comfortable that we're ready to take their referrals. Electronic communications, I think that now more than ever, because of the pandemic, because of social distancing and the limited availability of one-to-one contacts, not only in your shop, but at the referral source site, whether it be a primary care setting or a school, we're going to need to be able to get them information in different ways that facilitate that referral process to your organization. And we're talking about not only referral agencies, but also your payers. And again, rapidly changing market and rules are going to require new frequent contacts so that folks know that you're open, we're ready for business, and we want you to refer your clients to us. So a couple examples of electronic communication that I think are going to be very important as we move forward, and that is, as one example, would be electronic brochures. I think the days of being able to, go to a referral agency and hand out brochures that normally they would distribute to staff and can pass on to clients and families, for example, I think those days are going to be very, very limited, and our ability to provide our brochure electronically to referral sources and key contacts is going to be really, real important. Some key elements of your brochure, it doesn't have to be anything major, and I think for a lot of folks, a lot of organizations, developing these things may be something new, and so we need to come up with something fairly quickly that gets the basic information out about your programs and services, about the new protocols that you may have adopted in your organization around the health and safety issues. Certainly, if you're in a residential provider, this means a lot more because folks are going to be coming and bringing, youth and children into a setting where they're going to be living. What are the precautions that we're taking to make sure that we're going to keep your child or adolescent safe? Business hours may be different than they were before. How to make a referral, again, just kind of outlining, here's the number to call, here's how to schedule an appointment, here's how to schedule an assessment. All these things should be in that initial electronic brochure. The nice thing about electronic brochures is that you can pass it on very inexpensively to your referral contacts, and they can easily pass it on to clients and families and other community stakeholders in the community and really spread the word very quickly. Electronic flyers is another way that you can get the word out and re-educating your referral agencies about the status of your organization. I would probably get this out first before I got a brochure out, just to all of your key contacts and referral sources in your network, again, to let them know that we're here, here's the programs and services that are available, here's how we make a referral, here's the health and safety precautions or new protocols that we have in place so that folks feel safe, And then definitely the contact info and name and phone number. I would always include a key contact, the name of a person, their email, and a phone number, as I think a lot of referral sources are going to have a lot of questions moving forward, and you want somebody to be able to field those questions as quickly as possible. Last, another example, and really just a critical piece of referral source education is your website. I think now more than ever, people are going to be relying on electronic and virtual ways to fill in the gaps of the lack of the one-to-one contacts that we were traditionally used to having. And so taking a quick look at your website, making sure that it's user-friendly for payers, for your community referral sources, and for clients that may be looking for service is going to be really important. Many health plans make direct referrals to provider organizations, and they use the website as the number one way of knowing that you're there, the geographic area you serve, the programs that you offer as part of a network provider organization. Being able to have some way of appointment scheduling that can be quick and easy is going to be really important to have on your website. You may want to consider online portals, ways that if I'm a parent and wanting to refer my adolescent child to your services, that I can jump on your website, look at your programs and services, the population served, and if I'm interested in making an appointment, I can already do it online. I can do a complete pre-screening forms online. One of the things that we want to think about with regard to our online portals and digital pre-screening is if our outpatient settings are going to have limited capacity and social distancing issues, how many folks can we have sitting in a waiting room filling out these forms? Probably not that many. And so anywhere we can cut corners and reduce that obstacle and make it easier for folks to access your services is certainly going to be a feather in your cap. And again, and I kind of emphasize this throughout the presentation, the new pandemic health procedures. You want that on your website. You want to be able to have folks be able to see that your programs and services are safe, your staff are taking the right precautions, and then lay out whatever the protocols are on your website for parking and making a referral. Where is the nearest public transportation and all of those things. So update website is really, really important. Engage on social media. We're seeing more and more folks turning to social media like LinkedIn and Instagram and Twitter for looking for places for service. We encourage comments and sharing on these platforms. And so we just, I don't know, I think a lot of the small to mid-size provider organizations, social media may not be something that's been big on your radar screen. Now, though, more than ever moving forward, it probably is something you want to take a look at as part of your communication and outreach. So educating our provider networks and our referral sources is one aspect of getting our referral flow going again. We talked about making sure that in your message, whether it be in a flyer or a brochure or on your website or any of the telephonic communications you may have with referral sources, that you're updating them on your programs and your service and anything that's been changed, that you're open for business. You want to remind them again of your longstanding status in the community as an innovative and high quality provider. updating your marketing materials on the things we just talked about is really important. In revisiting your relationships, past and present, this is a really good time to do that during this process. So marketing outreach, I mean, really, we can go into that's a whole webinar on just marketing outreach basics. But I think in terms of your down and dirty crisis plan for now, let's get things moving again so we can get referrals going and revenue flowing. It's really about just making that phone ring again. You want to identify and prioritize your referral sources for marketing and outreach, and we'll talk a little bit about that. You want to conduct really a referral source outreach campaign. This really is going from the starting line as a provider organization, and bam, time to go, and kind of starting all over in terms of re-engaging key referral sources so we can get referrals going, and reestablishing those formal referral pathways that may have changed as a result of changes in your programs and obstacles and barriers that referral sources are having to deal with because of pandemic restrictions and safety issues. It's always been about building one-to-one relationships to have referral sources having confidence and trust in you to be a solid referral provider for their clients or stakeholders. Now that one-to-one, that one-to-one piece is probably going to be more being on the phone, a lot of emails, and then definitely being able to disseminate your electronic flyers and brochures. And really, it's about implementing new methods for making it easier for referral sources to make a referral. What are referral agencies looking for? Referral sources to make referrals based on how easy it is to get clients assessed or into treatment. So again, anything you can do to make it easier for them to make referral is critical. Digital communications that we talked about, getting your website updated so that it's user friendly and has tools that are available for folks making referrals, as well as clients who are trying to access care. Letting folks know that your programs are open. Availability of virtual screening and assessment, virtual tours. I think these two bullets are really, really important as you think about how we're going to engage referral sources with getting clients, coming to your programs and services. Is there an opportunity for virtual screening, for example? Is there a way that you can do a telehealth screening from a primary care setting to your intake department, where those types of things can happen live via some type of a virtual screening platform? Is there a way to do assessments virtually? We talked a little bit about the online portal on your website, having a referral source, even a client, filling out some type of an assessment tool ahead of time that your staff can evaluate and take a look at. All of these things are really important for helping your referral sources make that referral. The days of on-site tours and families coming on to tour your site or to do a meet and greet in an outpatient setting, to learn about programs and services, they're going to be limited. Can we do virtual tours of our programs? Is that something that you can put on your website so that somebody can push a button and have a tour, a video feed with a tour, and someone talking about the programs and services and how they work, and a visual video of your actual service site? I know that I just learned just a few weeks ago with one of the clients that I'm working with here in California. They're doing using their cell phone, going on and doing assessments for foster family placements, using the video on your phone to go into someone's home, and they're kind of doing pre-assessments that way. They're doing client safety checks where someone's walking around with the phone through every room just make sure that the house is safe for the client. A lot of folks are improvising and coming up with different ways to use these virtual methods of getting the job done. And again, we talked about online scheduling for appointments and online portals for making referrals. Very, very important in terms of what folks are looking for to make it easy to make referrals. I mean, really, we're having to reinvent the customer service experience. I think we all can. Most provider organizations have been around long enough to pride themselves on the relationships they have with referral sources, the systems in place, pre-pandemic for getting folks in the front door for assessment and into treatment. It's all different now. And I'd venture to say that because of the pandemic, the things that we're talking about, that customer experience, a positive customer service experience has really been lost over the past 3 months. Provider organizations, referral sources have been busy working on, staffing and revenue issues and, just running the business. And I think having got to the point of starting to look at how we going to reinvent a positive customer experience for clients now in this new world with some of these new obstacles. And so we want to be thinking about that. Kind of watching the clock here. Identifying and prioritizing referral sources for outreach. I mean, I think it would be important. We probably know off the top of our head, who our big referral sources are and who they've been in the past. But again, because of the changes in our provider network and our providers referral sources may have had, probably want to take a little more systematic approach and maybe looking at some of your internal reports, maybe your intake and client admission reports for, who's been making the most referrals in the past 6 months to a year. What types of clients are these referral sources referring? You may have a referral source that was referring clients that are specific to a service line or program that you're no longer offering. So certainly that's not someone we're going to put at the top of the list. We'll re-engage at some point. And definitely looking at referral sources that are making referrals to any of your specialty programs, because specialty programs tend to have higher rates of reimbursement. You may be involved in some kind of a performance-based arrangement and something like that. And so we certainly want to take care of those referral sources and make sure we're able to start filling slots, beds, whatever it happens to be, and making a priority. And certainly your marketing and sales reports should be full of pair and referral source trends and things that can help your team come up with, we're the first 10 referral sources that we're gonna call, we're gonna email, we're gonna get our electronic flyer out to, we're gonna schedule a Zoom or go to meeting with them so we can reintroduce ourselves and talk about changes in program service, how to make referral, and get those formal referral pathways reestablished. Remember, phone, email, webinars, virtual tours, video conferencing are going to be critical again because of the, I think traditional marketing outreach. You bring lunch to staff. We would do on-site trainings for staff at different referral agencies, business lunches, cocktail hour with the C-suite folks, and probably going to be a lot more limited. So electronic really is your go-to right now for getting started. Conduct a referral source education campaign. I mean, real emphasis needs to be put on right now and taking a look at the things that we're talking about. And it really needs to be something that your entire team takes a look at. You're developing goals and objectives for, how you're going to lay this out, and looking at all the things that we're talking about here. It really is a campaign. You're going to have specific targets. You're going to have specific goals in terms of who we're educating, how we're educating, what we're educating them on, and at the same time, looking for new opportunities for business. And we're going to talk a little bit about that as we go down some of these slides. But our reset is not only a reset of reintroducing our programs and services, getting referrals flowing again, but it's also looking for new opportunities for new business. We'll talk a little bit about some of your competitors may not be there anymore. Payers may have lost key provider organizations in their provider networks. As your referral source may have a new need, and how can we, start looking at developing that as a new service line, a new program, something you can add to your existing services for that relationship. And through this process, we really want a single point of contact at your organization who's going to be monitoring and troubleshooting the referral source process. It might be somebody in your marketing department. It might better be somebody in your intake department who can monitor and watch who's making referrals, what are the bumps in the roads that we're experiencing with referrals, what are the client obstacles that we as an intake staff are having to overcome as clients are calling us, as referral sources are calling us. And referral sources may have been able to provide you with, critical clinical information when making a referral. Well, because they're not able to have that one-to-one contact, it may be telephonic, they may be sending a referral without that information now. And how do we, as a provider organization, process a referral without having that? We'll have to figure out a way to overcome that. Anyway, right now I would say that every referral source counts, just like every referral that you get to your program is critical to adding census and rebuilding census. So, everything matters right now. A quick word on assessing the status of your competitors. And this really relates to how you're positioning yourself with your referral sources and the opportunity to look for new growth opportunities for your organization. Doesn't be nice if we had the time right now to do a whole market competitive analysis, but if there was some way that your organization can take a snapshot, who are our main competitors? How have they changed? Are they still in business? Do they have they curtailed certain service lines that they're no longer providing anymore? What are you hearing from referral sources about? Well, I tried calling A, B, and C provider, and they don't do that anymore. Wanting to find out where your competitors stand in the market is really important, and it's important for two reasons. One, you want to be able to try to redirect those referrals to your organization if you can. And two, you want to be able to see, identify if you can, who are the key payers for those organizations or those service lines, and is there an opportunity for me to approach that payer and say, I'm in this market, I understand one of your key provider organizations has downsized or is no longer in business. We can easily accommodate those referrals. We're willing to add a service line. We'd like to have that discussion with you. So, just knowing what's going on with your competitors is really important right now for this and your strategic repositioning. So assessing payer crisis needs, I truly do believe that there are your community-based referral source stakeholders, schools, primary care, social service agencies, other types of behavioral health, hospital systems, that have always been our mainstay for referrals. But I think right now, and especially right now, looking at our payers that make direct referrals is critical, and it's critical for some of the same reasons that we've talked about with your other referral relationships. Wanting your payers to know that you're still here, you're open, wanting to make sure that your referral pathways are still intact if you're getting referrals directly from payer or health plan care managers, crisis call centers, those types of things. But it's also a good opportunity, and we'll talk about that in a little more in a minute, to request a contract rate increase, as well as explore expansion opportunities. So I wanted to just talk a little bit about payers separately. Probably one of the biggest changes with payers that we've seen, one of the quickest adoptions for payers and working with providers and in their networks has been the acceptance of telehealth, not only for payers but also for clients and for provider organizations. It's huge, and you want to be able to increase. Where I lost my phone. So the telehealth piece is really huge. Health plans right now are very open to working with you on adjusting your contracts, adjusting reimbursement, sharing with you their new policy procedures as government guidelines have been relaxed. There's just a lot. It's been made a lot easier now for providers to use telehealth as a way to provide assessment and treatment for clients that we can't see one-to-one. I just threw in some recent stats. These come from Beacon Health Options that just shows the growth in providers in their network adjusting and adapting to telehealth. Their increase in questions from provider organizations on being able to do telehealth. And the last bullet I think is very telling about the way that our consumers out there are really taking to telehealth and are adapting to it. I'm working with one provider here in Los Angeles County who shared with me last week that telehealth has it's doubled their treatment engagements with their clients. It's been going really, really well. Clients have adapted to it very well, and so a real upside to the whole telehealth experience right now with payers. What are payers concerned about right now? As far as the last 3 or 4 months with the pandemic, in speaking with many of them, they're really concerned about losing providers in their network. They're concerned about provider organizations downsizing services because of the pandemic, the health safety issues and social distancing and whatnot. They're really concerned about limited consumer access to get services. They're seeing, and it depends on the market you're in, they're seeing issues with a slow transition to telehealth with some providers, and some provider organizations not able to do telehealth because of capital and just bandwidth issues. They see telehealth as a real win-win for everybody right now. And of course, all of this leads to their biggest concern, and that is that folks that need, their members that need, or payer clients that need, outpatient level assessment, intervention, treatment services, may not get in, and that always leads to the concern that folks aren't going to. Clinical conditions may become more acute, driving more of their members to emergency rooms, inpatient services for acute stabilization, all the costlier levels of care. So they're very interested in working with providers right now to keeping you whole, keeping you healthy, and being able to refer their clients to you. Identification and prioritization of your best payers for assessment. Again, I mean, there's a lot of ways to do it. I'm sure your CFO and CEO and COO, I mean, your director of intake, I mean, everybody's going to know right off the bat who your best payers are, and those are who you want to start with. Whether it's a payer that has the highest rates of reimbursement, whether it's a payer that has the lowest denials, you know, you can look at the highest number of referrals that a specific payer is making to you. Payers that have the best length of stays, you know, I mean, there's just a lot of ways to slice that pie. But what's important is that you identify, you know, the biggies and start re-engagement, and we'll talk about that in a minute. And remembering that no one payer is alike. Every payer, whether it be a county or a state or a health plan, a managed care organization, has different needs and different priorities in different markets, depending on the populations that they're serving, and everything you do with them will have to be customized along those lines. So conducting a payer crisis needs assessment, I mean, really it's just about you know, re-engaging your payers and reassuring them that you're still here, you're open, letting them know there may be some limitation in capacity in some of your programs and services. You want to let them know that you've got all the health and safety protocols and procedures in place so that they know that their members are going to be safe for treatment and care. You want to provide an update on any new service delivery platforms that you've implemented over the past 3 months, telehealth, any kind of virtual consultation platforms are probably in the top 2 or 3 right now that you've developed to be able to continue with assessment, treatment, case management, those types of services. You want to look at opportunities, again, to expand your contract with them. They're going to be well aware of changes in their provider network, of your competitors in that specific market or catchment area. You want to let them know that you're interested in assisting with developing new service lines for them, or other types of partnerships that could lead to some type of growth. You definitely want to, again, broach the conversation of increasing your existing contract rates. They know that provider organizations have had an increase in cost because employee wages might have gone up. The health and safety precautions that you've had to implement, the new technology platforms that you've purchased or expanded, all come at a price. And so having that conversation about some type of a rate adjustment on maybe it's on a specific service line, may not be across the board, but where you can get a bump, right now is the time to ask. And again, because payers are very invested in keeping their provider networks going. We're hearing that health plans have been doing this. We're hearing that county and state payers have been increasing rates. So it's definitely worth the conversation. Schedule virtual payer marketing and update sessions. Again, you may not have that opportunity to go to the local, you know, Anthem, Beacon, Cigna office because of the social distancing and the stay-at-home things. But let's get some things. Let's get some meetings on the books. Let's get some go-to-meetings, some Zoom sessions going with key contacts there, and conduct that assessment of the payer needs virtually. We don't want to wait. There's really no time to wait right now, as everything is very fluid. You want to, on those on your virtual marketing sessions, again, talk about your programs, any changes, all the safety precautions you've done. Schedule virtual marketing. That would be a great time to send them your virtual brochure and your flyers. schedule virtual marketing update sessions with key personnel. I mean, and I think the folks at the payer systems, at the payer level, whether it be a government payer or health plan payer, it's usually going to be call center staff. It's going to be care managers at a health plan, for example, that are traditionally would be making referrals to you. Field-based care managers that would be placed at treatment sites or other payer sites would certainly be good targets. Health plan account managers that are managing specific populations for a plan would all be folks that you'd want to re-engage in some type of a virtual platform, and again, reestablish that you're there and what you're doing. And obviously following up with the brochures and that kind of thing is going to be really important. Payer account managers. So your most organizations have somebody who is point person for working with your payers, your key accounts. I'm using the generic term as a payer account manager. Would be the person in your organization that has the relationships usually with your payers, again, whether they be public or private. This is usually the person that is involved in contract updates and renegotiations, dealing with any issues that a payer might have with billing, credentialing, those types of things, maybe clinical issues. Your account manager, again, is normally a standalone role, but it could be somebody in your marketing department if you have a small marketing team that is the single point of contact for your payers. These are the folks, again, that know who to go to at a health plan to set up these virtual marketing sessions. And these are the folks that are also responsible for really the customer service of taking care of the needs of your payers, which is really, really important, and even more important right now. So I would recommend that it be your account manager, or that lead person, be the one to lead those your payer crisis needs assessments with these payers. Leveraging preferred provider status with payers to increase market share and contract expansion opportunities is critical right now. A preferred provider organization is nimble, can adapt quickly to rapid changes in the market, and offer new solutions to payers in response to new service needs. And right now is the time to step up and be a leader in your market with your payers and reestablish yourself as a preferred provider. And that is a longtime provider that has always come through with timely access to care, strong programs and services, the ability to track and monitor your performance outcomes and provide reports and data to your payers. Has traditionally been customer focused, not only with the payer, but with clients and your referral sources, and truly has some kind of aligned goals with payers in your market. They're looking to these organizations right now to come up with the new innovations, to come up with the new service line expansion platforms. And so you really want to leverage your good standing with your payers right now to get that rate increase, to get those referrals going again, and to garner, as many referrals in the market as you can as a preferred provider in their network. So we've got, what time is it? We still have a little bit of time. I went through that fairly quickly. Like I said, I think each of these steps in getting the word out, referral source education, and then marketing planning can be separate webinars. But really today is more about just kind of getting this, start to get you thinking about these things, start to come up with your planning, and start to move now in terms of getting referral flow going back to your organization. I'll stop there. And
yeah, Richard, thank you very much. I think that was a comprehensive presentation. And as you just said, I'd like to remind our audience that we have other briefings coming up, in the web briefings coming up in our program, where we'll do a deeper dive into social media, into website, optimizing your website to get referrals. So please be sure to check the schedule on our website at openminds.com and to sign up for these for the upcoming briefings as well. But in the meantime, back to Richard. Thanks again, Richard. And we do have some questions that people sent ahead of time, which are up on the screen, but we'll just walk through them together. So if one provider organization executive wanted to know, if we currently do not have contracts with our local health plans, where would you suggest we start? Should we reach out and conduct a needs assessment with them?
Okay, the answer to that question is yes. Because of the potential movement in the provider networks for, let's just say, health plans right now, because of all the changes that provider organizations are going through, right now would be a great time to reach out to your local health plans and let them know that you're there and that you're interested in beginning contracting discussions about how they can become part, how you can become part of their provider network. Here are the services that you bring. They may say, we love those services, but do you do this and this? And there may be things that you may be able to add to your service lines fairly quickly. But the answer is definitely yes, because of the fluidity of provider organization, provider networks. This is a great time to reach out to your health plan.
Thank you, Richard. And on those lines, how does one become a preferred provider with health plans?
So I think, preferred provider, the term is kind of an old term that managed care organizations used to use a long time ago. I think it's still used now with payers, public, private, most of your health plans, and provider organizations. When we're referring to a provider that brings an organizational infrastructure and the service lines and systems to be able to meet all of a payer's needs. And so the first step in that is, whether you're already a contracted provider with a plan or you want to be, is to have that initial conversation. Let's say you're an existing contract provider. You want to be able to have a conversation with the plan and find out how you can do, I don't want to say a better job, but how can you be at the top of their list as a referral source, and as a preferred provider, you're someone that has an easy intake system for access to care, which is a biggie for payers. You're someone that has, again, as I pointed out in the chart, good, strong, you have good, strong treatment programs, but maybe you're not tracking them as well and have not been able to provide a payer with your data outcomes that would help inform them of your performance around things that matter to them, like HEDIS measures, getting clients in a timely manner, reducing emergency department visits, making sure that clients are linked to treatment, within 3 to 7 days after discharge. I mean, these are the kind of conversations you want to have with them to find out what it will take for you to really align your programs and services with their referral, with their treatment, with their case management, with their outcomes needs. And that's really what a preferred provider is. And again, you may be one and not even know it, but making sure that your payer knows that you consider yourself, a high-end, top-notch provider is important.
Thanks, Richard. So you had a lot of suggestions and electronic brochures and flyers and virtual tours and a lot of great ideas, but many organizations are constrained for resources right now. So if I don't actually have somebody to implement the great ideas you suggested, should I be trying to build a marketing and business development department now? Where do I start?
Well, that's a good question. I think that the short answer is you want to be able to just begin to develop some type of a formal outreach arm from your organization that's working with your referral sources, that's working with your payers. I realize that things are tight right now, but it may be adapting somebody that's currently on staff, but definitely someone there that can take on the role of coming up with, and maybe it's a team of folks that's coming up with your marketing objectives and your business development objectives. A lot of this is going to go back to revisiting your strategic plan, and probably now more than ever, that whole marketing piece is going to be really, really important to most providers, depending on the type of business you're in and the types of payers you have. But having some kind of a business development marketing lead is highly recommended for a lot of the reasons that we talked in this presentation.
Yep. And on those same lines, Richard, could you speak to the importance of having an account management role?
So, similar to my answer for number 3, I think that because of managed care, because of value-based reimbursement and all these things, provider organizations are getting more and more, there's more and more opportunities to have contracts with health plans, with managed care organizations, with large medical groups for services. And certainly that the payer book of business really requires, or we recommend, a single point of contact that can really build those relationships with those health plans. The idea of bringing network value to a payer. Payers want to work with organizations that they can call somebody when there's an issue with case management, with discharge planning, with billing, with credentialing, with contract issues, and having that key role, the account manager role, to field those calls, and then to be that go-between between the payer and your organization systems. Health plans will tell you, I've been told, we'll call you once, and if you put us on hold or transfer us, okay, we'll call you twice, and if nobody calls us back the next day, we're kind of done. We're going to go to the provider that when we call them for any of the issues I just talked about, there's somebody that they can talk to immediately who's a problem solver and is there to see to the customer service. It's critical. It's just critical in the competitive market that we're in, that there's someone in that lead role. And to answer the question, maybe it's not a separate account manager role. Maybe it's just somebody in your marketing team that takes that on. There's just so much going on with health plans right now, and opportunities to work with health plans, that having somebody in this role is just becoming more and more essential. Depend on the market you're in, and depend on the kind of services you provide, but it's quite valuable.
Yeah. Well, Richard, thank you for that. And I don't see any more questions coming in from attendees at this time, but I do want to share that people have found it very helpful, and they especially liked that all of your strategies and tactics that you suggested were geared to the health and human service sector. So our attendees appreciate that. I wanted to pass that on. And thank you again for all of your great advice. We also thank all of our attendees for taking the time to be with us today, and you will get a recording and slide deck by tomorrow morning. So thank you all, and I look forward to seeing you at our next web briefing.
Thank you, everybody.